Guys, in this video, let us look at enuresis. So, passage of urine in the clothes. The child is having no bladder control. That is beyond 5 years only if it happens, okay? Then only you will call it as enuresis. So, below 5 years, you don't expect the baby to actually have any so much of bladder control. So, remember, it is beyond 5 years, usually beyond 5 years, okay? So, for this, there can be some psychological stressors or some physiological dysfunction that can happen, because these people may have a hyposecretion of vasopressin. So, those could be the causes of enuresis. So, you can understand that can actually be a cause, or there can be just a stress, okay? And this can be primary or secondary. That means primary means that child has never established control, and secondary means it had established control which has lost now, okay? So, based on this, you will have to treat. Now, how will you treat this patient, guys? You'll have to first take the history and find out if there's anything wrong with this patient. Else, what you can do is, you'll try non-pharmacotherapy, like behavior modification. Like you can try motivational therapy, making the child void its bladder before it goes to sleep, reducing the intake of liquids before bedtime, right? Just giving a sip of water, sip, just small sips, okay? Not that you have to dehydrate its tongue, etc. Then you should maintain a diary which will encourage the child. You should not scold the child, right? Then you should make sure that it is sleeping comfortably. Sometimes they are not sleeping comfortably. There might be mosquitoes which are biting them. They are just tossing and turning the whole night because of some issue with the bed. Maybe there are ants on it, etc. So which makes them make a lot of more urine. So you have to check all that. And when the child tosses and turns in the bed, you should make it get up and void its bladder in the night. Okay, all that you should do. Okay, and then dry day, dry night, everything you have to check. You have to encourage the child to void its bladder frequently. There are some alarm therapy that is to tell it that there is a full bladder. When it senses that there is a small little wetness in the diaper or underwear, it will start giving an alarm, and then you make the child go to the bathroom. Okay. This type of things are available a lot in Amazon, okay, just check that. Then anyways, you have to rule out the cause, like as a doctor you should check that there are no worms or constipation or UTI, right? All this you have to rule out. So for worms you have to give deworming for the child, albendazole, etc. Constipation you have to treat, and UTI, if it is there, basically urinary tract infection will cause urgency, right? So a lot of problems will be there. Frequency, urgency. So basically UTI, urinary tract infection, urine analysis you should do, check if there are any bacterial growths, and you should also check if there is any congenital anomaly in the child which is causing frequent UTIs, okay? Now let us come to pharmacotherapy. We are getting started with pharmacotherapy, where this is where you will get some marks as very specific points. Anticholinergic drugs, remember, anticholinergics do what? They will retain, they help in urine retention, etc., right? So these are, they can reduce uninhibited bladder contractions for children who are having daytime urge incontinence, and even if they have nocturnal enuresis, all that it will help, okay? So what are they giving here? Oxybutynin 5 mg, okay, 5 mg oxybutynin, or 2 mg of Tolterodine, 2 mg of Tolterodine they are talking about, and at bedtime they are giving all this, okay? At bedtime they are talking about this anticholinergics. And this is given only for 6 year above, okay, greater than 6 year child, okay. Then you have desmopressin, let's remove this one, desmopressin, that is DDAVP, sounds like DDAVP, okay, desmopressin. So what will it do? It works by reducing the volume of the urine. So basically desmopressin reduces volume of urine. See, the content of urine can still be same, at least the water level can be reduced, so the volume of urine will be less, right? So if you stop this medication, they can again start relapsing, okay? So if you stop this medication, can cause relapse. Stopping this medication can cause relapse, okay? So this is something bad about it. This one they are saying they don't use it anymore because it causes side effect, cardiac arrhythmia, okay? So anticholinergics, oxybutynin is what you have to remember. Oxybutynin, you have to remember, guys, oxybutynin, you say, okay, you'll get marks, oxybutynin for nocturnal enuresis, remember, pediatrics. Do you remember from your pharmacology classification of anticholinergic drugs? Go down here, synthetic compounds. Here, are you seeing oxybutynin? This is a vasicoselective, it says. What is this? Vasicoselective, makes you pee like oxybutynin, tolterodine. So all these are things that you have learnt in your pharmacology already. Okay, remember this. Oxybutynin makes you pee less. Hope you have understood treatment for enuresis, bedwetting. That's it for now, guys, from our side. Bye bye.